What is immunohistochemistry? 4. Rare bone tumor diagnosis. Imagine trying to identify a tiny piece of a puzzle that looks almost the same as others. That's what diagnosing rare bone tumors can feel like under a microscope. Sometimes, traditional tissue examination isn't enough to tell one tumor from another. That's where immunohistochemistry comes into play. It's a lab technique that uses special antibodies to find specific proteins in tissue samples. These proteins act like unique fingerprints for different tumor types. In diagnosing rare bone tumors, immunohistochemistry helps clarify what kind of tumor it is, where it started, and how aggressive it might be. Because many bone tumors look similar under a microscope, doctors relying on IHC to distinguish between them. For example, it can tell apart primary bone tumors from cancers that have spread from other parts of the body. It also helps classify small round blue cell tumors, which include aggressive cancers like Ewing's sarcoma and other similar tumors. IHC detects proteins that are produced by gene changes or mutations in the tumor cells. This can indirectly show if certain genetic alterations are present, which helps in understanding the tumor's behavior. For instance, markers like MDM to ANCDK can help differentiate low-grade malignant tumors from benign lesions. These markers are like flags that signal the tumor's nature. The choice of which proteins to look for depends on the clinical situation, imaging results, and what the initial tissue looks like. Usually, a panel of markers is used, including both those that are positive and those that are negative, to get a clearer picture. For example, in rare round cell sarcomas, markers like CD99, WT1, ETV for B-core, S8HB2, and cyclin D1 are used to tell different subtypes apart. Sometimes, if IHC results are unclear, molecular genetic tests are needed to confirm the diagnosis. Beyond just identifying the tumor, IHC guides treatment options by helping doctors classify the tumor precisely. Knowing exactly what kind of tumor it is can influence prognosis and the best course of therapy. But it's important to remember that IHC is part of a bigger picture. It works alongside clinical exams, imaging scans, histopathology, and genetic testing to give a full understanding of the tumor. In summary, immunohistochemistry is a vital tool in the diagnosis of rare bone tumors. It helps identify and classify tumors more accurately by detecting specific protein markers. This detailed information supports personalized treatment plans and improves patient care. Always consult healthcare professionals for a comprehensive diagnosis and tailored treatment options, as each case can be quite unique.